Welcome back to Showcase Pittsburgh on KDKA-TV. I'm John Klein. A big show today. Don's Appliances will be here. Wade Heating and Cooling, Allstate and Columbia Gas. But right now, Dr. Ian Bulow from Revive Upper Cervical Chiropractic here to get us into alignment. It's great to see you again, Doc.
Always a pleasure.
Let's start at the beginning. In case there's somebody watching, you've been on a bunch of times, but if there's somebody watching this morning who's not familiar with some of the things that you personally have been working on with an upper cervical is neck.
Yeah. Sometimes there's some confusion in what the cervical part of the body is, and when we say upper cervical care, we are referring to the neck region. The neck is the cervical area of the spine. But make no mistake, the main reason we specialize in this area of the body is because it's the point where the brain communicates with the rest of the body. So if somebody has a neck issue, it's not just a neck issue. Just like if somebody has chest pain, it could be a heart issue, right?
Okay.
If someone has a neck problem, it could be influencing how well their brain is controlling the rest of their body. So for us, it's of utmost importance for a variety of reasons.
You told us last time when you were on, you can start this at a very young age, and there are a lot of symptoms that maybe infants have that young parents are watching right now that could possibly be corrected with upper cervical care.
Yeah, absolutely. That's one of the reasons we like to come out here and share what we do, because most people just don't know. They don't. There's really not a differential diagnosis. It's a fancy term, and it basically means when you go to the doctor, if you have a symptom or a condition, they'll go through the list. Well, it could be A, it could be B, it could be C, and if it's not all of those, then they may not know. But nowhere in the medical list of possibilities, especially when it comes to non-neck problems, is there a list what could be the neck as a root cause.
Give us a couple of examples.
Sure. So starting off at a young age, a lot of children that we see in our office have chronic ear infections, and they clear up within a matter of weeks.
An ear infection can be based out of the neck.
Yeah. And in fact, there's a very obvious connection between the difficulty of the labor and the more types of symptoms the child has. So if you think about a baby, a normal birth process is it to be pushed through the canal. But if there's a lot of pulling involved, the little tiny muscles and ligaments in the neck can become strained.
Makes sense.
And all those nerves get irritated. And what will happen is people will get, the little babies get the colic, the screaming in the night. Parents, it's funny, if you think about it, when you have children, if the baby won't turn on one side, you're taught the modified holding positions. But really, in truth,
there's a reason.
Why is the baby not turning both directions? And then if you follow that child later on in life, they're the kids that have the ear infections. And then later on in life, maybe ADD, maybe headaches. We've even had children with some pretty serious seizure disorders come under care.
And it can all be centered around the neck.
Yeah, I will tell you this. This is by no means, I'm not here to say it's a cure-all, but I am here to say that because the brain controls and coordinates every function of the body, it should be considered. It needs to be looked at when people are dealing with chronic health issues.
Let's talk about, we talked about this on past shows, concussions.
Yeah.
Whether it's a sports-related concussion from a child or, you've been in a car accident.
Yeah.
And it seems like concussions, especially like in the NFL, front and center right now. And this is a lot bigger deal than we thought it was.
Absolutely. And I was just talking with a couple clients of mine that are involved with the universities, and there's debates coming up in the fall and whether or not children should be allowed to play sports. And it's an interesting discussion. Again, the reason we're here is I think that a lot of these sports and a lot of these activities are fair game so long as we're paying attention to the neck. The problem is that with a concussion, most specialists are looking up at the brain, because that's what happens in a concussion, is the brain gets shaked up a bit. But in the process, there's typically, again, some ligament damage, some muscle tearing, some instability in the neck. So when the concussion goes away, but the neck problem remains, we label that, a lot of times, post-concussion syndrome.
Okay.
So we have these people going around with chronic headaches, chronic fatigue syndrome, trouble focusing, loss of memory, neck pain, numbness and tingling, and really they're running in circles because nobody's looking at the neck. So most cases that come in, the high schoolers and the college kids, we're seeing very high success rates in getting them resolved within a matter of weeks to a matter of months.
What about some aging seniors who might be watching who are having some sort of physical or mental issues that they're struggling with?
Sure. What we see as the aging process goes on is if we don't take care of our spine, just like if the tires in your car are not in proper alignment, you said it well in the beginning of the show, getting back in alignment.
Yep.
If your tires are not in alignment, they tend to wear, right?
Yeah, makes sense.
And with adults, if they have injuries and accidents or really tough jobs early on in life, then later on they tend to develop arthritis, neck pain and back pain, and we see a lot of that, and that does very well when we restore proper alignment. Just like putting the tires in your car back in line, you have a smoother ride.
Okay,
you know what I mean?
It makes sense.
So we definitely see a lot of that, as well as vertigo, some dizziness, some balancing issues are pretty important as you age, and that has a lot to do with the ears, the neck, the eyes. It all comes back to how well that brain is balanced when it comes to those types of issues as well.
Is there any extra training that you had to go through to get to this level?
Sure. I sit on the board of the Blair Chiropractic Society. I'm a certified instructor, and the International Chiropractic Association just actually started a specialist program, a diplomat, a postgraduate 3-year intensive program, and I'm one of about 20 to 30 doctors from around the country that meet multiple times a year. And so yes, the upper cervical work that we do, it is different. It is. And sometimes that difference makes all the difference in the world for patients. We've had patients that have been to chiropractors, have been to orthopedists, have been to physical therapists, and find resolution in our office because that extra detail, it's very gentle, it's very precise, and our goal is if we do our job right, is that patients should need us less and less over time. In my thought process, the mark of a good adjustment is that it holds for a very long time and doesn't need to be readjusted all the time.
That was my question. With a lot of these situations, if a child is having ear problems, is that something that can be fixed or worked in 1 or 2 sessions, or is this something that they would have to deal with for years?
Sure, exactly. You know, it's interesting. That's maybe a good topic for another show, because what happens in most of healthcare is we want that quick fix.
Yep.
But the problem is, as soon as that treatment stops, the problem comes back.
Okay.
Like someone who's on a blood pressure medication, you ask them what would happen if you came off that medication. A lot of times the blood pressure goes back up. So
we do need some maintenance.
Well, yes and no. Some conditions we want healing, you know, and that may take 2 days, 2 weeks, 2 months. But our goal is when the issue resolves, it resolves. We expect the body to heal. Our job is not to micromanage a condition for the rest of your life. Our job is to get you healthy so that your body can heal. Now, how long you want to function in that state of health, that's up to you. It's not my job to browbeat people, but we do expect resolution and healing.
A lot of people watching right now are going to write down this number. Thanks, Dr. Bulow.
Sure.
If you'd like to know more about Revive Upper Cervical Chiropractic, the number 724-772-7060, or log on to revivepittsburgh.com. Up next, Don's Appliances. They have a warehouse of choices for you and some great deals too. That's on the way next when Showcase Pittsburgh continues.